Hello, everyone, and thank you so much for listening in to this town hall. My name is Simran Kaur Malhotra, and I am the health data reporter here at the Red and Black, and I will be the one moderating today's COVID-19 and the community town hall. We have some amazing panelists for you to listen to today, so let's go ahead and introduce them. Firstly, we have Dr. John Torres, who is NBC News' senior medical correspondent, an emergency room physician, and a U.S. Air Force veteran. Throughout his career, he has made numerous humanitarian trips to Central and South America, providing medical care to children in need. Utilizing his combined medical and military experience, Dr. Torres teaches NATO Special Forces today. He has also just launched a new book yesterday called Dr. Disaster's Guide to Surviving Everything, Essential Advice for Any Situation Life Throws. So make sure you check it out. Also, we have Dr. Jason Smith, an experienced chief medical officer with deep roots in Georgia, who joined St. Mary's healthcare system recently as the system's new CMO. Dr. Smith returned to Georgia from Marshfield Medical Center in Beaver Dam, Wisconsin, where he served as CMO from 2016 until now. Additionally, we have Paige Cummings. Paige Cummings is the executive director of Athens Nurses Clinic, a nonprofit health clinic for uninsured residents of Athens and the surrounding counties. She graduated from the Medical College of Georgia School of Nursing and entered the Navy Nurse Corps, and Paige has also worked with the Red Cross Blood Services. Last, but certainly not the least, we have Professor Sabriya Rice. Professor Rice directs a professional master's degree program at the University of Georgia that prepares students to cover health and medicine. Professor Rice has worked as a health and medical journalist at organizations such as CNN, National Geographic, and the Dallas Morning News. Ms. Rice has also served as Director of Media Relations at the American Cancer Society and is a current board member for the Association of Healthcare Journalists. So those are all of our amazing panelists. Thank you all so much for being here. I really appreciate you taking out the time to not only answer our community's questions, but even serve as role models to some of our STEM and journalism students here at the University of Georgia. So, how will this panel work? Well, a question will be presented to a specific panelist, and then they will answer the question. After they've answered the question, a discussion where I will ask branching questions will start, where anyone can add what they're thinking, what they've experienced, or on the basis of their experience, just their 2 cents. So I encourage that when a question is asked to someone specific, that the other panelists also think and have something to talk about related to the question to engage in the discussion afterwards. The discussions will last about 5 to 7 minutes between each main question. Now, the audience will also be able to ask questions through the YouTube live stream chat or via our social media. Our social media channels are listed in the live chat on YouTube. So the first half of this town hall will be our questions to the panelists, and then we will ask questions from the audience. We won't be able to get to all of your questions, so if you have a question that you'd like answered and we don't get to it, you can email me or DM me on my social media. So without further ado, let's get started. I will ask our first question to Dr. John Torres. Dr. Torres, how difficult has it been to report reliable information, given how much even medical officials have had to learn about COVID-19? And looking back, is there anything you would have changed about your coverage, particularly at the beginning of the pandemic last January, March? Please go ahead.
It's been an interesting change from pre-pandemic to after pandemic, because pre-pandemic, we typically, and I'm talking about both at the local stations I was at here in Colorado, and then at network stations, NBC in New York City, was able to get behind more information, more time to develop the story, and get to the nut of what was actually important there, and get down there to that kernel to give the information that people needed. And one thing I've always done across the board is make sure that I leave the message with the viewer with a message of what they can use to take home with them, what kind of thing can help them in their own lives. I wasn't always able to do that beforehand, but once the pandemic started, initially I started off the same way, trying to develop stories that took longer periods of time, trying to develop stories that took a little more in-depth research, talking to more experts and days to develop, but very quickly found out that I was no longer able to do that. I didn't have that luxury because the information was changing so fast. And what I've been telling people is what the public is seeing right now is typically what happens behind the curtain, behind closed doors. Science usually takes place over years and decades, and that information slowly comes out once results are given. Here, we're watching science in real time. So my job evolved to making sure that people understood what that was, and also making sure that people understood that just because a piece of information came out doesn't mean that that's the final information, doesn't mean it's going to be the most accurate information, and doesn't even mean it's information that they necessarily need to know. But one of my mandates early on became making sure that what I talked about was scientifically sound, and making sure that I gave people information that they could use, news they could use to keep them, and as I always say, themselves, their family, their loved ones, their community as safe as possible during the pandemic, and get through it as quickly as possible. So what that meant was expanding my network of who I had that I was able to call, of the experts I could call. And part of that were experts I used behind the scenes to just get information from, and saying, I've heard this study, this result came out, what does it mean in the context of the overall pandemic? And then other experts I would use on air on the various platforms. The other thing I found out is my platforms had expanded. Instead of just doing nightly news or the Today Show or MSNBC, we started a variety of platforms, anywhere from what we call NBCLX, which is looking at Generation X. We looked at News Now, which is Gen Z. We're doing Nightly News Kids Edition, which are children. And so I had to change the message depending on what platform I was going to, but I didn't change the science or the outcome behind it. It was just a way of delivering it. And so I had to learn how to do that. And as far as what I would have done and changed early on, I would have changed my message quicker as far as the delivery method, and making sure that I got it and was addressing that specific audience in a way that they understood it. Because it did take a while for me, and I think for a lot of us, to understand that getting that message across was important, but getting it across to the way that people could understand it in their own terminology for whatever generation they happen to be in was equally important to get through that. And then one big mandate I always had was essentially sticking with my own beliefs and my own thoughts, and making sure that the science was as sound as possible, because it's very easy when you're there, when you're under the gun, when they're asking you questions very quickly and the information's coming very quickly, to say whatever you think the viewers want to hear. You need to make sure that you say what is accurate instead.
Thank you so much, Dr. Torres. And taking a viewpoint of actually being in a hospital or a clinic here in Athens, with that new information that was always coming in, constantly changing, if not daily, then weekly, Dr. Smith, how were you able to take over St. Mary's Hospital and make sure that the guidelines were being followed by everyone in the hospital as they were constantly changing?
Yeah, so that can be a difficult thing to do. We utilized our incident command structure. I got here on February 24th, and within 6 days, became the incident commander for our COVID-19 response. So it was an interesting way to be introduced to St. Mary's and to that area. But through that incident command, you're really able to delegate out responsibilities. You have a marketing communications chief, you have a planning chief. You really want to make sure that all of those chiefs are constantly looking at the data, looking at the science, talking to their peers, understanding what's going on, and then communicating that to the broader St. Mary's Hospital community. It is difficult, but it is doable. And then you have to round and validate. So one of the things that we did on a constant basis was have ourselves, the senior leaders, and then others within the organization who were in leadership roles, to constantly go to the floors, ask what people understood, what they didn't understand, and then reinforce what we were telling them. So it was really just a lot of time and a lot of effort, a lot of one-on-one interactions that really made the difference.
Thank you so much. And if we look at a clinic perspective, Ms. Cummings, was it similar? Was it different to what Dr. Smith is talking about? What was different, essentially?
Well, of course, we're a lot smaller. I mean, there are a few of us who are as old as dirt, so we've sort of been through this. And when we were watching all of the news reports in February, we knew that something was going to happen. So we started getting our PPE ready and getting our clinic policies ready. We also watched what the Athens Clarke County Commission was doing and listened to what Mayor Gertz wanted to do. And I have to commend him for taking control early on to try to get people to shelter in place safely. So what we decided when we knew that the commission was meeting is that we would have to go to a telehealth model. So instead of seeing our 20 to 30 patients every day, we started doing telehealth. And for 2.5 months, that's all we did. Now, I should correct that. We had a few people who would drive up and we would run down from the second floor out to the parking lot to do some acute assessments on things. But for the most part, it was all telehealth. Then in late May, when we opened the clinic again, we had gotten air purifiers for every room. You can't come into the building, of course, without a mask on. And we had a little check-in station where someone in full PPE would check and ask those vital questions. We arranged our schedule so that nobody was sitting in the waiting room. We never had more than 2 people coming in. And we invited our older volunteers who did not feel comfortable to not come. We wanted to make sure that our staff, as well as our patients and volunteers, stayed as healthy as possible. So about late May, we started back up. We're still seeing patients. We're open Monday, Tuesday, and Wednesday every day. Everything is free. I would say that at least 2 patients every day tell us that they either had COVID or had tested positive but didn't know they had COVID, or they have a close friend or family member. And so we still keep watching. We test all of our clients who are willing to go through it for COVID. And we also banded together and formed a health wellness coalition with Charles Smith from Habitat Restore and Michelle Johnson from Mercy Health Center and Jennifer Richardson from the Athens neighborhood. And Charles got a CARE Act grant that got us a truck loaded with supplies. And we set up to go out into the community. And the grant was for us to do 750 COVID tests in the low income and homeless community, where there are people who weren't really going to go out to be tested anywhere else. And so Charles worked with Family Connections and with the 16 Prosperity team leaders, and we ended up doing 1,750 COVID tests on the low income and indigent communities. So it came out to about a 10 to 12% positive rate, which was about the same rate as we saw in upper income levels. And we just keep following them and inviting them to come into the clinics to be seen.
Thank you so much. I think it's really important seeing a firsthand approach about how things went, whether you're looking at it and actually working in a healthcare setting, but also reporting that information. So thank you all for answering that. My next question is for Professor Rice. Professor Rice, how can journalists approach stories concerning in a diverse way that highlights the health disparities amongst people of color, especially the Black and Hispanic communities that have been hit the hardest, per se, during this pandemic? Please go ahead.
Thank you, Simran. Yeah, it's a great question because a lot of these disparities existed before COVID, right? What COVID did was really elevated it, right? People who were not aware are now aware about some of the disparities that existed. I think representation matters in this case. So having access to the communities, being able to know the hesitations that people might feel and why they feel those things, and speaking to members of the community. That way you figure out where to go, who to talk to. Because I think the important thing from the journalist perspective is getting the message to the people who need to hear it. And that's also the directive of public health experts, right? They also want the same thing. So we're moving towards the same goals, but if you're not engaged in the community, if you don't have proper representation within your newsroom, those things become a challenge. The other thing I wanted to mention is something that Dr. Torres mentioned, is this idea of need to know, right? Like there's a lot of reports and a lot of information that was circulating at the beginning of the pandemic that was very confusing to the public, right? And so I think we surveyed over 100 members of the Association of Healthcare Journalists. So journalists who are reporting on healthcare every day, like Dr. Torres does, and like I used to do. And misinformation was a big thing that they were finding, they were spending a lot of their time combating. And that was particularly so, and it still is in certain communities. For example, right now in the Latino community, there's a lot of information circulating about what the vaccine can do to your body or things that can happen, and being able to dispel that means you have to reach the right audience. Thinking about putting reports in other languages, having representation within the community, I think those are the things that we can do from the newsroom perspective to reach all of the public that needs to hear it.
Thank you. And I know, Dr. Torres, you yourself are Hispanic. Would you like to add anything to that?
No, and I agree with that. And it's interesting because early on in the fall, this is about October timeframe, I actually did a story here in Denver where a community health center were giving out flu shots in the community itself. They had set up tents and doing it, and they weren't doing it specifically for the flu. They were doing it to test a system for when the COVID vaccine came out, because they knew they would have to get down to that community level. And so it's important, like was being said earlier, that getting to that community level and talking to them in their language and with people they trust, because it's easy for me as a doctor to go in there and tell them they need the vaccine. It's easy for governors and mayors to go in there and tell them they need a vaccine. But if it's from somebody in their community, whether it's a religious leader, a community leader, a friend, someone in their neighborhood telling them they can get it, that's going to hold a lot more sway with them than it is for some authority to tell them that. And the other thing I found out, which I think is a good segue on what was said earlier, is getting that information across. But also part of my job was to having reporters understand exactly what message they were trying to get across versus what message they were getting across, because there was so much misinformation out there. And one of the examples I can give you is right now what's going on with the Johnson & Johnson vaccine, where 6 women have had blood clot issues. And I would tell the reporters, let's put this, and this is a couple of days ago, don't forget to put this in perspective. That's 6 out of almost 7 million. That's less than 0.0001%, and we're not even really sure it's connected yet. And so you have to put that in proper context so they understand, because it's easy to have a headline, 6 women had blood clots from the vaccine. It's more important to get behind the headline and say, this is a very rare condition. The FDA is pausing to look at that right now. And so the things are happening that are supposed to be happening. Otherwise, you increase things like that vaccine hesitancy, and that's not something that any of us want to do.
Thank you so much for bringing in the Johnson & Johnson vaccine. It's the talk, especially in college right now. The University of Georgia received a shipment of J&J, administered them for a day, and then had to halt. Can you give more of a perspective straight to our viewers? What is going on? Should they be scared? We do have vaccine hesitancy in our community. How can we combat that? And after Dr. Torres, I'd love to hear from Dr. Smith as well. Thank you so much.
And the one thing you don't want to do is you don't want to panic about it. You don't want to get overly concerned about it, but you definitely want to be aware of what is going on right now. And like I mentioned, there are 6 women between the ages of 18 and 48 that had blood clots 6 to 13 days after getting the vaccine. What we don't know is that connected to the vaccine, because that's a rate of 1 in a million people getting those blood clots. These are rare types of blood clots. In any given year, without the vaccine, 4 to 5 people per million end up getting this type of blood clot. So it happens regardless of the vaccine or not. And that's why I'm saying we're not exactly sure it's connected to the vaccine. But the FDA, in overabundance of caution, said, let's put a pause on Johnson & Johnson and try and find out what's going on. While we do that, let's put out the message that, hey, if you got the vaccine within the last 3 weeks, there's 4 things you need to look for: severe headache, abdominal pain, leg pain, and shortness of breath. If you notice those, talk to your doctor so they can further check into that. But for everybody else, if it's beyond 3 weeks, really don't have to worry about it. And what we're going to do, the committee met today and they're going to continue to meet. They're going to probably come out with some type of labeling saying, these are the people that should get the shot going forward. These are the people that might want to get one of the other shots going forward. But this doesn't mean that the Johnson & Johnson shot isn't safe. It just means that we're finding out as more people get it, that there are certain people who might not need to get it or shouldn't get it, but we don't know at this point yet.
Thank you. And Dr. Smith, would you like to add on to that?
Yeah, I would just add that perspective is extremely important here. We're seeing this in 6 women in the childbearing years. Many women today take oral contraceptive pills, that you're much more likely to have a blood clot from an oral contraceptive pill than you are from this vaccine, assuming there is a connection there, which we, as Dr. Torres mentioned, don't know yet. So there's really no reason to panic at this point. I think this is also a great illustration of how our VAERS program, the vaccine associated events and reactions, worked. I mean, it really has worked to point out there could be a problem here. And so it really should give the public a lot better sense that we're really taking all of this seriously. It's not been just rolled out and forgotten about. If there are adverse events, the VAERS program will identify those and we'll be able to take care of that. So I really think things are going very well. As Dr. Torres mentioned, we may wind up with a system where women in these age groups or potentially with other risk factors may be recommended to get another vaccination versus getting the Johnson & Johnson. But I have no vaccine hesitancy. I've gotten it. My wife is getting it. I recommend everybody who can safely take it receive it.
Thank you. That is awesome to hear. Hopefully the majority of our community has been vaccinated, especially University of Georgia is making grand efforts to do that. Our next question is to Ms. Cummings. Ms. Cummings, going back, what has been the mental health impact of the past year on your staff in the clinic? There were lots of efforts to celebrate frontline workers early, but 12 months later, they're still on the front lines.
And we're getting tired. We're like all the other frontline workers. It becomes physically and sometimes emotionally exhausting. We don't want to take anything home to our families. Luckily, we've all been vaccinated, but for the first 10 months, 11 months, we weren't. And there was a great deal of concern. We have some who have small children, some who have teenagers, and some of us had, like I said, we're older and not always the healthiest of spouses. So as it continues, I think we're going to see more and more health care workers becoming stressed and depressed if they aren't already. But we're seeing, we hope, a turn for the better, which would make everyone feel a sense of relief. I think when we walked out of the health department the Monday after they started giving vaccinations, and we had like the first 12 appointments, we walked out and had a big sigh of relief because at least we knew that we couldn't take it home to our families. And we stayed in our own bubble anyway. But that doesn't mean you don't worry that something could happen.
And just a follow-up question for you, Ms. Cummings. Currently, has there been backlogs in vaccine supply at Athens Nurses Clinic, or have you been able to efficiently put supply in arms as distribution has grown?
Well, let's talk about the vaccine hesitancy. The Nurses Clinic is 65% Black and Hispanic. And luckily, our patients know us and trust us because they started out flat out refusing to get vaccinated. And we, even though the clinic and several of the staff are GRIT certified, we found it easier to go to the 2 primary pharmacies that serve the clinic and have our patients, when they go by to pick up their medications, we made appointments for them to get vaccinated. So we are slowly able to work through our clients, but it's taking a lot of convincing. Like with a lot of our minorities, they don't always trust vaccinations in the system. Luckily, they trust us enough to be willing to listen and agree to do it.
Thank you. And Dr. Smith, have you experienced the same thing for St. Mary's Hospital? Has it been different?
So we've not had any backlogs of vaccine. As soon as those vaccines come in, they pretty much get put in arms. Our biggest issue has just been with supply. So of course, the state of Georgia has issues getting vaccines in, and we have issues getting it from the state of Georgia. But as soon as those come in, we're putting them right back out into arms. We have not had the supply that we wish we could have had in order to vaccinate all of our patients who are associated with our clinic structure and that sort of thing. But we have opened our clinic to everyone 16 and above, whether they're associated with St. Mary's or not.
Thank you so much. It's always nice seeing a firsthand approach again, as I was saying. Our next question is for Professor Rice. So what we're looking at here is a lot of politics in this pandemic. What changes have you noticed in public perception of news media in regards to the politics of this pandemic?
Yeah, we're really struggling right now with trust. That's not just because of the pandemic. I mean, newsrooms are shrinking. It's getting harder to get the information out that needs to get out. And that means people are working twice as hard with less resources. And so I think, there's a lot that can be done. I support local journalists, and if you're out there watching, please support your local newsroom. They need you in terms of covering these things. For me, looking at it, covering healthcare over several years, something interesting that happened during the pandemic is just how political it became. I mean, this happened in the middle of an election year while there were nationwide protests about race and injustice. And a lot of the communication in the beginning, especially about the details of the pandemic and COVID-19 and those kinds of things, were coming from politicians. And it was really hard to get information from the experts at the CDC and other places. So I think that exacerbated the issue a bit more. And that's something new that I've seen during this pandemic, mainly the politicization of the disease, of its spread, and how the information got to the public.
Thank you. And Dr. Torres, would you like to add on to that?
I agree completely. And that was one of the issues I had to contend with at the beginning of this, because initially it started off with science, but quickly within weeks it delved into politics and where did it start? Why did it start there? What do we need to do? And who's at fault? And one of the things I always try to do, and this is one of the things that here at NBC, we have a medical health unit, and we have health reporters in that unit who are very good and very knowledgeable about medicine and health in general. And so they tend to be the ones that other reporters and anchors look towards for information, for accurate information. And one of the things we always talked about is that as a unit ourselves, we decided we were going to be above the political fray. We are going to rely on science. And so every time, and this is the way reporters and anchors work, this is how they do it. It's just a different mindset. Doesn't mean it's right or wrong. It's just a different way of looking at things. Is they would try to ask the political type questions, particularly, if somebody had done this, would we be in a better position now, with that type of thing? And my answer would always be, listen, I'm looking at the science, and the science says we need to do it this way. And the fact that we didn't do it this way has led us down this path that we're in the worst position right now, or we're in a better position right now. But I would never point fingers. And what happened, what evolved over the months, is I ended up being a very trusted voice, because I stayed above the fray and I made sure that the health reporters also stayed above the fray. And so as a unit, we became the most trusted unit in NBC at the time, and we still are. We're one of the most critical units there for the pandemic. And everybody looks to us for that opinion, that voice, and they know that we're not going to be political on this. We're just going to be purely scientific. And if we don't know the answer, we're also going to tell them we don't know the answer. And the answer has not come yet. Like we talked about with the vaccine, we're not sure, but we'll let you know as soon as we find out, which means as soon as they find out. And so it's very hard because it's tempting to get into that political fray because you have your own personal opinions, but you want to stay above that, especially when you're talking about health issues, because that is what's affecting people out there if you're a health type reporter. Now, if you're a political reporter or investigative reporter, that's a completely different story. But if you're a health reporter, you need to focus on the health, not the politics.
I love that you brought that up because it'd be nice to know, what do you believe the federal and the state governments could have done better in the health sense of things to maintain safety, to maintain health, and prevent more people getting COVID-19 once it was introduced, not only to the nation, but especially our small communities such as Athens?
And again, one of my mandates is not to point fingers at any specific entity or any specific group, to stay, again, like I say, above the fray here. But historically speaking, what we've noticed with different pandemics, and part of my career in the military and in the emergency room was doing disaster preparedness. One of the things, anytime you have a disaster, is you have to have a central system of control. And that was one of the issues at the beginning that we lacked. And part of that was because we were caught a bit by surprise. You would think that in 2021, we'd be better prepared as a nation. And this is not pointing at any specific group. This is just pointing at historically overall for the last 20, 30 years, we haven't gotten the preparation we needed. And so we were caught to a certain extent by surprise, and we didn't have the system set up to have that centralized control. And the way this country, if you look at other countries, New Zealand, perfect example, everything is done at a central government system to the point where they literally call every hospital every day and have meetings to discuss what they needed when there were PPE shortages. They would call every hospital and have a conference call. What do you need? Okay, hospital A needs masks. Hospital B has extra masks. We'll get to hospital A, that type of situation. Granted, they're a smaller country, but here we have a very segmented system. And that's just the way the system is set up. So that became very difficult at the beginning, and it took a while for the process to evolve to the point where that was getting more controlled and better done. And so that was probably what I saw early on. And again, not to point fingers at any specific entity or any specific group, but we were just all caught by surprise.
100% agreed, especially just speaking with the experience of being just a student. So we are moving towards questions from the community. James from our YouTube live stream has a question for Ms. Cummings. He asks, we have seen many nurses play such a critical role in this pandemic. Can you briefly explain the nurse's role in now a COVID patient is, when a COVID patient is treated?
Well, actually, since we don't have COVID positive patients coming into the clinic, I would have to try to shift that over to Dr. Smith to see how the nurses at St. Mary's are doing.
Yeah, so we could not have survived this pandemic without nurses. Nurses are the backbone of American healthcare, really, but especially hospital-based healthcare. They have gone just above and beyond what anyone could have ever asked of anyone in the healthcare system, doing anything and everything. I mean, even the protocols that we've put into place called for them to take on new responsibilities and responsibilities that, you know, normally environmental services or someone else would take in order to diminish the number of people that we have in and out of a patient room. While they've been giving life-saving medications, they've also been standing in for patients' family members because family couldn't come in and visit with their loved ones because of COVID restrictions. And while they're doing all of that and dealing with us doctors that are always creating so many problems, they're also having to worry about am I taking this home to my family? And how do I protect myself? And, the stories, especially early on in the pandemic, of nurses going home, going into their garage, completely undressing in their garage, if maybe even having a shower if they have access to that outside of the home, changing into new clothes, then going into the house in an attempt to not take this back to their family members. It just is mind-boggling what our nursing colleagues went through and all that they have done throughout this entire pandemic. It just has been amazing to witness it. It really has.
100%. And there's a question for Dr. Torres. Dr. Torres, what do we need to do now with the vaccine rollout happening in our nation? And what do we need to do in order to prepare ourselves for the next potential pandemic?
So the two different questions there, I'll answer the vaccine one first. The main thing is getting to that level of herd immunity, which we're not still exactly sure what it is, mainly because this is the first time we've been through this virus pandemic, but we think it's in the 70 to 85% range. And if you do the numbers mathematically, even if every adult in the country got vaccinated, we'd still be a little bit shy of that, which means we need some of the children vaccinated as well. And now we're getting the vaccine tested in 12 to 15-year-olds, 12 to 18-year-olds, depending on the vaccine. And pretty soon they're going to start to be able to get vaccinated as well. And the important part there is, one, to get them protected, but also let them go back to school without spreading the virus or having problems with catching the virus. To get that level of herd immunity. But the concern is right now, if you look at the numbers, there's anywhere from 15 to higher percentages of people with that vaccine hesitancy that it's ingrained in them. They haven't changed their opinion since the start of the surveys were taken at the beginning of the year. And that's going to be a hard population to break through. And so getting an understanding to them of why they need the vaccine is going to be very important. And part of that is going to be what we're seeing here now is the FDA. And I think part of that is our job as reporters to report, number one, accurate information, but also to give them the other side of the story. Like I said, it's easy to say 6 women got blood clots. It's more difficult because it takes more time and more understanding to say that 6 out of 7 million, we're not sure they're connected. And you can take confidence in the fact that the FDA is doing what they need to do to keep us safe, meaning they're pausing the vaccine and they're going to look at it, figure out where they need to go, and then move forward. We've seen that with numerous medicines throughout the pandemic and vaccines as well. But as far as pandemics going forward, my whole career has been working on disaster preparedness, both in the military and in the emergency room. And one thing you find out is people get very excited about it. They put in a lot of money and effort into it for the first couple of years after something like this, any disaster, including a pandemic, but we also have very short memories. And that pot of money you use to have that disaster preparedness in place is very tempting for people to use for other things. And so keeping that going forward, I think for the next couple of years, that'll be easy to do because memory will serve us for the pandemic. But after that, remember, so far these pandemics, as large as this one is, have been 100-year events. More than likely, estimates are these will be closer and closer together. But as time goes on, it's going to be more and more tempting to take that money and use it for something else. Less preparedness will be there. So it's going to be hard to keep that momentum going, but it's going to be important to keep that momentum going.
100%. And that's why we have such amazing nurses and doctors in our community to keep it going. Our next question is for Professor Rice. Professor Rice, how has the pandemic shifted the line between ethics and morality in journalistic reporting?
Ooh, well, that's tough. I think as journalists, we aim to uphold high ethics in our reporting. We have a code of ethics that we try to follow. I think in terms of the pandemic, as Dr. Torres mentioned previously, things were just happening so rapidly, and a lot of people are not trained to cover healthcare and science, which is partly what my role is to do. So to avoid crossing those lines, right? As Dr. Torres mentioned, reporting what you know, right? And not falling for the press release with the with the exciting headline. That's really hard to do when you're new to the beat, and everyone was new to the beat this year, or like there are significantly more people on the healthcare beat than in the past. So I think I don't think people were purposefully crossing any ethical boundaries. I think the influx of information that was coming in and lack of preparation for reading scientific studies and knowing what a preprint is, for example, and those kind of things were happening in the beginning. So I think from a journalistic perspective, I think healthcare crosses every other beat. Business, education, science, sports. And so having someone trained locally in your newsroom who knows some basics, right, I think could be very helpful.
Thank you so much. Our next question is from our publisher, Rebecca. She's great. It's for Dr. Smith. Some colleges and universities are requiring vaccines for the fall. University of Georgia has not commented on that yet. They're actually asking us not to anticipate that the Board of Regents will make it mandatory. Do you think we're going to be seeing more universities across the nation making it mandatory? And is it helpful?
So, this is something that I don't know, but I'm not a journalist, so let me speculate. Probably. I mean, I would just guess that we probably will see additional universities begin to require this. We've seen various industries. My wife happens to be a travel agent, and we're seeing the cruise industry that's going towards mandatory vaccination in order for you to start cruising in the near future. There's been at least one hospital system in Texas that is requiring that their employees become vaccinated. Trinity Health, who is the system that I work for and that St. Mary's is a part of, has not made a decision as of yet. Currently, it is not mandated, but it could at some time in the future. We just don't know. Is that helpful? I would like to see us reach herd immunity, and for us to get there, is the right way to do that via mandates from various employers or governmental agencies? I think that's a political question, and I try to stay out of the politics as much as I possibly can. Healthcare has enough politics as it is, so I don't know if that's the right answer or not. I think the best thing that we can do as healthcare proponents is really to get the injection ourselves, to continue to voice positivity around the vaccination as much as we can, and to meet people where they are. People shouldn't be ostracized because they choose not to take the vaccine. We have to understand why is it that there's that hesitancy, and perhaps we can help people overcome that hesitancy. But I've yet to be able to shame a person into taking a medication or a vaccine. So I really don't think that's the answer. It's more understanding and more communication, which I think as a community and as a country we can use more of in general.
Dr. Torres, let's dissect the politics out of it. What do you think?
And I think you have to look at it with two different mindsets. And one mindset is the public health mindset of protecting the public. And in cases like that, you want as many people vaccinated as possible to get to that herd immunity and even beyond, so you can keep that under control. But then you have the individual rights mindset too, of like, not everybody is going to want to take this. And you have to divide the groups between those that can't take it and those that don't want to take it, but are able to take it. And those are the ones that we need to look at and say, okay, what message is getting to them that they don't quite understand why it's so important, and what message is getting to them that needs to be changed so they have a better understanding of what's going on. Now, when it comes to community entities like universities or hospital systems or things like that, part of that I think is going to depend on what they're actually doing. Right now in the hospital systems, there are hospitals that mandate the flu vaccine, And so this is one other vaccine they could mandate to protect not just the employees, but also the patients that come in. In a school system, university system, it's a bit different because that is also a closed community. And it's not unlike in the military where we live in barracks sometime, and you have to be very careful with diseases spreading through that. And so, you know, the fact that our universities are already mandating certain vaccines, meningitis vaccine, MMR vaccines, you know, this is another vaccine that they could certainly mandate. And I think you're going to see more universities doing that. Now, the one issue that's being had right now, and this is both in the military and I think in the regular world, is that this is under these vaccines are under an emergency use authorization, which is different than approval. So the military right now can't mandate it because of that EUA, but once it becomes approved, they can then mandate it. And I think you'll see other systems do that as well. Theoretically, they're going to be going for that approval here in the next few weeks and probably getting it sometime in the next month or so. And so once they get that, I think you're going to see things change as far as the mandate, but at the same time, it has to be done very carefully because you don't want to ostracize people and make it even more of a political issue.
Thank you. And just a follow-up question from Gargi Patel, a student. When will the vaccine be available to population younger than 16?
Well, right now, what they're looking at is that 12 to 15-year-old age. They are actually submitting for an amendment. This is Pfizer is submitting for an amendment to their EUA. Now, the difference there is that amendment to the EUA doesn't require a complete new emergency use authorization. They just have to have a quick meeting to say, yes, it looks safe for this age group. And then, of course, the CDC goes through their process of deciding how they get it with dosing and everything. And by all indications, this will happen over the next couple of weeks, that amendment. And so more than likely, those 12 to 15-year-olds will be able to get the Pfizer vaccine probably in May timeframe. As far as Moderna vaccine, they're right behind it, so probably a little bit longer than that. Johnson & Johnson, it's anybody's guess as right now because of some of the concerns that are going on at this point. So the goal is to try and get this age group 12 and above vaccinated by the time they go back to school in the fall, so they're better protected.
That sounds awesome, especially having a younger sister who is eager to get back. The next question is for Ms. Cummings. What is something that you did not implement at the clinic pre-COVID, but something that you're going to carry on now that you've learned through the pandemic?
I'm really not sure. We have always used some level of PPE. We've always tried not to have any kind of crowding in our waiting rooms or in our exam areas. I'm not sure. I mean, there are things we adopted more stringently, but we had always done those at some level anyway. So I'm not exactly sure where we would change.
And a follow-up question from Jeremy. What effect has the pandemic had on incoming nurses, do you think, or incoming medical students?
We have interns, usually from the School of Public Health or Family and Consumer Sciences, but we'll, you know, any of the programs. And a lot of them are pre-med or looking at the CNL nursing program or PAs. And we continue to get requests every day of people who want to come and get the experience and work clinically with us, which will help their applications. So I think if anything, it might inspire them. It might inspire fear, but will also inspire the need to want to help people.
Yes, thank you. And going off of that inspiration, next question is for Professor Rice. How has teaching health journalism changed? Has it heightened interest? How have even your students adapted to the pandemic?
I definitely say it's heightened interest, both from the students that we have here, and then also kind of new members to the Association of Healthcare Journalists. I think everyone has recognized that this is a valuable area of journalism, and that having more people trained in it is a good thing. So I think that's what I've seen. I think the level of interest in classes, the number of people who are less afraid to tackle things like statistics and data visualization, which became huge for getting COVID numbers to the public. I think those things have changed, and I hope they stay that way.
I hope so too. I know I came in as a health data reporter during the pandemic. So, learning just how to kind of take on the reins is definitely tiresome, but it's rewarding at the same time, making sure that everybody's getting that information. So as we're approaching the end of this town hall, I'd like to end on a note where each one of you guys just look into the camera and let our community know something that you've always wanted to share during the pandemic. It can be about anything. So Dr. Torres, I'll let you go first since you have to leave soon. Please go ahead.
I think the main thing is just the understanding that, yes, we are going to go through this. And I was asked a couple of months ago, what would be the one word I'd use to describe the pandemic? And the one word I came up with was resilience, because I think it's really shown just how resilient we are as not just individuals, but as a community, even more importantly, and how willing we are to go the extra step to help other people out, even in the midst of ourselves having issues. And the resilience of being able to stay home for months on end, to not be able to have physical contact with other people outside our little household groups. And the understanding that, yes, the patience of waiting until this gets through and doing the things we need to do to get this over with sooner rather than later. There's that saying that it takes a village, and we've learned that it truly does take a village. It takes a whole world to get this pandemic under control, and we're working in that direction. Yes, we've made stumbles along the way, but together we're getting there. Together we will get there, and we're going to get there sooner rather than later. And I think, before I wouldn't talk about the light at the end of the tunnel because things kept going back and forth. But now I truly do think we are seeing that light at the end of the tunnel, and it's getting brighter day by day. We just all need to buckle down a little bit more and have a little bit more patience and keep doing the things we're tired of doing to get us through this.
Professor Rice, go ahead.
Well, sure. I would say, at the beginning of the pandemic, journalists weren't in the same dire position as the healthcare workers, but they were still out there trying to get information to the public to the best of their abilities. And while it started with kind of national headlines in that first case in Washington, it became really quickly that people wanted to know specifically what was going on in their community, how many cases were present in here in Athens, how many people were hospitalized? What do I need to do here now locally? And having local journalists is really critical to being able to get that information and being able to support our communities. So I would just say to please support your local journalists and newsrooms who I know Red and Black was breaking news in the middle of the pandemic at the start. And that was amazing. And they need your support in order to continue that.
Thank you. Ms. Cummings, go ahead.
I am immensely grateful, as are many of the nonprofits in Athens, of the support and encouragement we continue to receive, the support to our low-income populations, everything from Athens Eats Together, which passed out over 240,000 meals. They did a tremendous job of coordinating that. They kept giving money and support and volunteering in all these different places, even knowing they could be putting themselves at risk to make sure that Athens as a community survived together. And that's really critical.
Thank you so much. And Dr. Torres is going to be leaving soon. So just a quick goodbye and good luck. Thank you so much for everything.
Right. Thank you. This has been wonderful, and you guys are doing a great job.
Thank you so much. And we'll end, last but not least, Dr. Smith, what would you like to tell our community?
Yeah, so I would just say that, despite the fact that we've lived through the past year where we've had to largely be separated, I think that in many ways, this time has really brought us closer together. While we may not be physically close, I think many of us are much more spiritually close and emotionally closer than we've ever really been before. We've really learned to lean on each other. We've learned how important our community support networks are. And, I've seen a lot more episodes of people of themselves, whether that's just buying the next person in line's lunch or opening doors, just being civil to each other, because we missed that contact for so long. So this doesn't need to just be, in my opinion, like we all get that Christmas spirit or the Thanksgiving spirit. And, you know, for those few weeks or months out of the year, we're just really happy and giving. We've lived through this for a year. Let's at least make this next year just that much better and share everything that we would want to have shared over the course of that time. We really can make our community, our state, and our country and the world a better place, one person at a time.
Thank you so much. And thank you so much to all of you who have taken out your time to just give an insight to your lives and your experience. And to the audience that is watching, make sure that you get vaccinated first and foremost, that you're still following the guidelines. The pandemic is still there, but that doesn't mean that we're not there for each other. Make sure that if you have any questions that we couldn't answer tonight, you can email them or DM them to us or to me personally. We can hopefully get out there. So thank you so much and have a nice night. Bye-bye.